Signs that you're entering perimenopause may be a little bit more subtle than you may expect. Some women may have intense hot flashes and night sweats, being woken up in the middle of the night in a panic. And other women may experience some more subtle anxiety or depressive symptoms, some mood changes. So it's not something that will alert you to thinking, oh, my hormones are changing, but maybe I should focus on other areas of my life, including exercise, stress management, and proper sleep, which is very important. But we may not think that it has to do with our hormones. What can make perimenopause a little bit more difficult to manage and understand is that you're still producing hormones. You're still having your ovarian cycles. You're still menstruating if you have your uterus. And so to a general doctor, everything's going to appear normal. Usually if lab testing is done, your hormone labs are going to be within the normal ranges, as they should. Your ovaries are still doing their job. When you're working with a menopause specialist, your experience is going to be a little bit different because our eyes are attuned to specific things as far as that lab test, but also our ears are listening for certain signs that may indicate that hormones may need to be brought in. Your labs aren't always going to reflect what you're experiencing. And so when it comes to menopausal hormone therapy, we're looking at the symptoms that you're experiencing and potential cycle changes if that's a part of the picture for you. It is for some where women will bleed more or bleed less as far as an increase in frequency in their cycles, having more than one in a month, for example, or they're skipping months in between. But whether that's a part of the picture or not, when it comes to menopausal hormone replacement therapy in regards to treatment, we're looking for specific menopause symptoms. And what surprises a lot of women is they often are told by medical providers that they have to wait until they're fully in menopause to be treated, and that's absolutely not the case. Perimenopause, which can start between 40 and 45, plus or minus some years on either side, can be over a decade long. And yes, it's a natural, normal process, but suffering is not mandatory. And we can absolutely utilize menopausal hormone therapy, estradiol, progesterone, and even testosterone to help smooth that ride out so that you can enjoy and manage the symptoms that come along with perimenopause for a lot of women. As a menopause specialist myself, I specialize in menopausal hormone replacement therapy for women in perimenopause and menopause. If you're looking for a menopause specialist to work with, you can reach out to my team. We are available in about 23, 24 states now for telemedicine. If you don't live in the states that we can service, you can go to menopause.org, which is the North American Menopause Society, and look at their national directory of providers, or womenshormonenetwork.org and look at their directory. By the way, I do lives on TikTok every Tuesdays and Thursdays at 5 p.m. PST. We go through all the topics under the umbrella of hormone replacement therapy. So I will see you there.